Today we're going to talk about polycystic kidney disease. This is a disease that is inside of the kidney. First, we're going to talk about anatomy and physiology of disease. We're going to start with the structure of renal capsule, which is connective tissue around the kidney. Then we're going to go to the renal cortex, which contains the nephrons of the kidney. Nephrons resembles a funnel. It has different sections that are responsible for excreting and absorbing substances. We have the renal artery that supplies blood to the kidney. We have the renal hilum, which is where the kidney opens for the arteries and the nerves to enter, and the veins and the ureter to exit. We also have the renal pelvis, which is where the urine drains from. And we have the ureter, it's where the urine drains to get to the bladder. Before you talk about diseases, always good to know what the functions of the kidney is. So the function of the kidney is it eliminates waste, it regulates body water concentration, regulates blood pressure, and maintains constant pH. You always want to have a constant pH because you need to have a homeostasis balance. And it also eliminates waste from the blood. Now we're going to talk about the actual disease, polycystic kidney disease. It is an inherited disorder characterized by numerous grape-like structures of fluid-filled cysts in both kidneys. It enlarges the kidney and it ruins the kidney's tissue. The cysts that develop interferes with their ability to filter waste products from the blood. The growth of the cyst causes the kidney to enlarge and can lead to kidney failure. And not only does the cyst may also develop in the kidney, but it can also develop in particularly other organs like the liver. There are two types of kidney disease. The first one we're going to talk about is autosomal dominant polycystic kidney disease. This is the most common disease, and it has mutations on chromosome 4 and 16. That's how they know that it's autosomal dominant polycystic kidney disease. It is more common in adults, and the symptoms do not occur until middle age. It is generally a progressive multi-system disorder that is characterized by bilateral renal cysts, which is cysts on both kidneys, not just one. It damages the filtering ability, and often it leads to end-stage renal disease, requiring renal replacement therapy. Now we're going to talk about autosomal recessive polycystic kidney disease. This is the less common type of disease. It normally appears in infancy and childhood. It progresses more seriously and can end in renal failure, causing early life and death. And that would be why it's more serious, but not common. We also have some incidence rates of disease. It progresses very slow. 68 million people in the population per year will get end-stage renal disease when having autosomal dominant polycystic kidney disease. There is no incidence rate difference from a male or a female, besides that males are more seriously affected. So this disease will affect the renal function. It can be completely preserved, excretory function, or severe renal function. The disease, if it's severe renal function, it will require emergency dialysis. The renal function can also be completely normal, and you can still have polycystic kidney disease. Completely normal renal function is normally shown in younger children, and as the disease gets worse, it advances. The renal function gets worse. There is an interesting statistic that I found out that polycystic kidney disease is a common disease. About 500,000 people in the United States. The autosomal polycystic kidney disease is more common, with 1 in 500 to 1,000 people are affected with autosomal dominant polycystic kidney disease, whereas autosomal recessive polycystic kidney disease is estimated to have 1 in 20,000 to 40,000 people in the world to have polycystic kidney disease. You also want to know some helpful information about this disease. Well, signs and symptoms I find is very helpful because you always want to be aware if you have the disease or if you see symptoms of the disease. So first we're going to talk about hypertension, which is a main sign and symptom for polycystic kidney disease. So it normally occurs in 70 to 80 affected adults because of the renin-angiotensin-aldosterone system. Hypertension is important in delaying the progression of end-stage renal disease. As uncontrolled hypertension increases, you can have a risk for proteinuria and a faster decline in renal function, which means your kidney will stop working faster if you continue to have hypertension, which is high blood pressure. You also need to detect the hypertension early and treat it early because cardiovascular is the main cause of death these days. So more people die of cardiovascular disease than they would probably die of polycystic disease because of the hypertension. Hypertension is also associated with morbidity and mortality of heart disease. We also have some other signs and symptoms, which are pain. So you have abdominal pain, a swollen and tender abdomen will cause pain, urinary tract infection will cause pain. And also I do want to say, whenever you do have pain, it's not going to be like consistent pain. You're going to have intermittent episodes of acute pain, really, really strong pain. So when you do have acute pain, it's probably caused from cyst rupturing or hemorrhaging, or you can have a cyst that's infected or a kidney stone. You also have to be careful with aneurysms. Aneurysms is a ballooning and weakening area in an artery. So polycystic kidney disease has an increased risk of abnormal bulging, which is an aneurysm, in the large vessel called the aorta. You have your aorta pumps in your abdomen, or in a blood vessel at the base of the brain. Aneurysms can be life-threatening if they tear or rupture, so you need to be careful with that sign and symptom and treat it. So some treatment options. This disease does not have a cure. The only two things that you really need to focus on is to slow down the growth of the cyst, because the more cysts you grow on your kidney, or the bigger the cysts get, the worse your kidney gets and the more that it will stop functioning. And you need to treat the signs and symptoms and the complications, because you're going to have pain and all that. So some pharmacological agents that will treat the signs and symptoms and the pain is antibiotics, pain medicine, which is analgesics, antihypertensive agents, and diuretics. So those are some medicines that will help with the signs and symptoms. So we do know that this disease can be very life-threatening. So when it does become life-threatening of your kidney not functioning anymore, you will end up getting treated with dialysis. Dialysis removes solutes, toxins from the blood because the kidney can no longer filtrate it. So if dialysis doesn't work, there's a next step that you can do, and that is to get a kidney transplant. A kidney transplant is very hard for somebody to get because there is such a long list, but that is another option to have to treat polycystic kidney disease. Now I'm going to end this slideshow with some diagnostic procedures to find out if you have polycystic kidney disease. Well, we do know that polycystic kidney disease is an inherited disorder. So if you have a brother, sister, mom, dad, grandma, grandpa that has polycystic kidney disease, you should be aware of your body when you see different signs and symptoms of what they had. And you should go get checked yearly to make sure you don't have it, or to make sure that you're treating your disease so that it doesn't progress and get worse. So you probably will start off with a physical examination because you have obviously pain. So you have a physical examination with the doctor, you get a urinalysis, and you will also get a blood chemistry, which is blood tests. So it's tons of blood tests to see if you have polycystic kidney disease, to see what type of polycystic kidney disease you have, and how they're supposed to treat it. You also can get an X-ray and abdominal ultrasound. So an X-ray and abdominal ultrasound will take pictures of your kidney, possibly to see if there are cysts on your kidney, if they don't find out that you have it from a urinalysis or a blood chemistry. So this is the end of my PowerPoint. These are some references to show where I got my information from. I hope you enjoyed and you learned a lot about polycystic kidney disease. Thank you.